Good morning, everyone. I welcome you to another edition of Medical Minutes. I am Dr. Peter Russotto, your host and moderator. We welcome Dr. Marshall Hale, a board-certified family physician affiliated with Memorial Physician Services. Many of you may remember when Dr. Hale was here for the inaugural broadcast when the subject was influenza. The topic of our broadcast today is the Hospitalist program here at Passavant Hospital. This program started approximately 18 months ago, and there has been much concern within the patient community. My discussions with Monica Eoff of the Community Relations Department informed me there has been a lot of confusion, fear, and misinformation since the start of the program. I feel that our broadcast today with Dr. Hale should inform and educate, calm some fears, and enlighten you as to exactly what a hospitalist program is. I also wanted to speak with one of the hospitalists from Passavant, but due to scheduling difficulties, this was not possible. A little background on the history of the hospitalist program in the United States. The term hospitalist was coined by Dr. Robert Wachter and Lee Goldman in 1996 in an article that appeared in the New England Journal of Medicine. It is widely accepted that the definition of a hospitalist is a physician who specializes in the care of hospitalized patients. Recent estimates state there are 30,000 hospitalists in the United States. Approximately 3,300 large hospitals have a hospitalist program, and more than half of all community hospitals participate with a hospitalist program. This is a trend that is rising, and my statistics are about a year old. Within the last 10 years, hospitals utilizing hospitalists have increased exponentially. So in a sense, I want you, the listening audience, to know that here at Passavant, we are participating and following a national trend. Before we start our discussion, I'm sure that I can speak for Dr. Hale that we encourage you to discuss and ask questions about a hospitalist with your family physician. To expand on the definition of a hospitalist, basically a hospitalist is a physician that deals with the patient's complete medical care and the coordination of all specialists and subspecialists for that patient during the hospital admission. The hospitalist is available and on call for that patient 24 hours a day, and they do that for a week at a time here at Passavant. At Passavant, we also have two hospitalists who alternate 1 week on and 1 week off. So we turn to Dr. Hale, and we welcome him again. And the first question I have for you, Dr. Hale, if a patient of yours is admitted to the hospital, is there any communication between yourself and the hospitalist?
Yes, Dr. Russotto. Good morning, and good morning to our listening audience. One of the things that makes the hospitalist program so successful, I think, for our patients safety at Passavant, is the excellent communication that occurs between the hospitalist and their private physician's offices. When the patient is admitted, documents are prepared which are sent within 24 hours to the attending physician's office so that the attending knows the patient is in the hospital, what the ongoing problem is. Oftentimes, if the hospitalist has questions, the primary care doctors are all readily available by phone in their office after hours to connect and discuss cases. The good news is that the hospitalists here at Passavant are so well qualified that they're very, very good at arriving at the right diagnosis and treatment, and it's very seldom that we have much to add other than maybe a little bit of past history for the patient to their care.
Does the hospitalist ever have access to your electronic health records?
Yes, as most of our listening audience probably recognizes, some like it, some don't. The paper record is pretty much gone. The offices in town are all electronic. The really good news about that is that's completely portable. It's accessible anywhere that someone has access to a computer. And yes, the hospitalists at Passavant Hospital, Dr. Gill and Dr. Dang, have passwords and procedures so that they can access our patients' records on the hospital floor 24 hours a day, 7 days a week.
So that makes the transition basically from like your office to their admission almost seamless, because then the patient really, his medical or her medical records are at their disposal at all times.
That's correct. Our office notes that we complete timely on the day that we see them, where we've documented medication changes, allergies, their current problems. If we've been treating them for a pneumonia that we thought we could treat on an outpatient basis, they've gotten worse and now they're hospitalized. The hospitalist can look in that record, see exactly what we did the day before, the week before, the month before.
Yeah, so that dispels the myth that the hospitalist doesn't know anything about me. That was one of the fears when a patient comes into the hospital and they have a new doctor. But that sort of goes by the wayside since they have access to the complete medical record.
That's correct. It's still a little bit more satisfying or encouraging to have the regular face that's seen you for 30 years be at the bedside and help you with your pneumonia. But as far as clinical expertise, there's nothing lacking in the hospital's ability to arrive at diagnosis, provide appropriate treatment. In addition, as the hospitalization proceeds, the patient's in for a couple of days, additional updates are placed into records. I can access those. If the hospitalist has questions, they always call. And then at the end of the discharge, at the end of the hospital stay with the discharge, they prepare a full document that has the pertinent clinical findings that occurred during the hospitalization, medications that were used, a complete list of discharge medicines is prepared by the hospital, and this is all within the first 24 hours after discharge so that it's in the patient's record most always by the time they come to see us within 4 or 5 days.
So that also makes the transition back from the hospital to your office seamless also, and then you have access to all that information electronically at Passavant.
That's also correct, yeah. Passavant's current record system allows us to do that timely. We can access that 24 hours a day, 7 days a week. So the information flows back and forth from our office to the hospital, but then also from the hospital right back into our office.
So basically the program, as I stated earlier, has been in existence now for 18 months. What do you see are the big advantages for your patients who are admitted to the hospital?
They have several advantages. They're probably not real evident to the patient, but what we see is with the hospitalists concentrating on just patients in the hospital, they have the ability to see the patients a couple of times a day. They can see them early in the morning, assess their clinical status, order additional tests, come back in the early afternoon, have the results of those tests, repeat an assessment, and maybe even change therapy twice in one day so that the length of hospitalization has dropped for our hospitalized patients. This is important from healthcare savings costs. We're all trying to save the national budget, but it's also safer for the patient. The less time that you spend in the hospital, you're less exposed to other sicker patients. Contagious diseases are less exposed the shorter time that you're there. Plus, nobody likes to be in the hospital. If you're able to get home a half a day or a day early, that's a good benefit. It's something the hospitalist can do and is just so labor intensive for the primary care doc to make rounds in the morning, work in the office all day, come back at night and make rounds day after day. It's just not long-term feasible.
So there not only is an economic benefit, there really truly is a medical benefit, which you talked about, the exposure to resistant organisms and such.
That's absolutely right.
Do you see any possible disadvantages so far in the last 18 months?
You know, the patients that have been admitted out of my practice, of course, I get to see them face to face and talk about their experiences. I've not had anyone that's had an adverse, a bad clinical outcome that didn't like the fact that they got better quicker and got home quicker. Of course, they're concerned. They ask, well, why don't I go to the hospital? Why can't I do this? And, you know, they're used to seeing me for a long period of time. We've had lots of trials and tribulations, as all the primary care doctors in town have. You kind of miss having your good friend at the bedside. And so we just explain that the benefits that they get by having the hospitalist, but also the benefits that they have in the office by having me in the office longer periods of time. In our office at Memorial Physician Services, we have the ability to see any patient that calls on that day. And we have that because I'm no longer tied up in the hospital making rounds, handling problems over the noon hour, where I can be available to see patients that call and want to be seen that day. So that's a benefit that they've recognized.
Yeah, for our listening audience, that means like the 2 hours where you were going to maybe be rounding during the day, now you're in the office and you can see X amount of patients. So it's a benefit to your whole patient population then that they can get in on the day that which they call.
That's correct.
In the medical literature, you briefly talked about that the length of stay is shortened on the average when there's a hospitalist, and we talked about the medical benefits and also the economic benefits. But I think there's also a social benefit and an emotional benefit, because the patient has a test, and a lot of times there's that mental anguish waiting for the physician to come in the next day or the day after to find out. And now almost immediately they're told the results of their test.
That's correct. The hospitalist's responsibility are to see the patients that are on the floors that they're taking care of in the hospital. And as they finish their rounds in the morning, they turn right around and round back through, looking for labs, for x-rays. If there's pathology tissue that's back, they have the ability to sit down the same day and go over those results, not only with the patient but with the family. Families know this can happen, so they may schedule a visit back to the patient late afternoon before the hospitalist leaves for the day, so that they have firsthand knowledge of what those tests are that day.
Yeah, that's a big advantage. Basically, I want the listening audience to know that really whoever the hospital is on call that day, they're in touch with all their admitting patients 24/7.
That's correct. That's correct. And they handle the phone calls at night. When they leave the hospital to go home to rest at their homes, the nurses are calling them for any orders or changes in condition, so that it's the same person that's seeing you in the morning is answering those phone calls at night during that hospitalization.
One of the concerns that was conveyed to the Community Relations Department at Passavant was, well, when I get admitted and then I get discharged, am I going to be able to go back to my family physician? You touched on that. I want the listening audience to know, of course, you will take them back.
Oh, absolutely. Yeah, the interaction between myself and the hospitalist and the other primary care doctors is that the hospitalist does not see patients on an outpatient basis. There's no necessity to. We have the capacity and the ability to see them timely and quickly. And with the seamless flow of information, it's just like you have two doctors that's providing your care, one that does the office, one that does the hospital, and it turns out to be basically the same person because the information flows so easily.
The only other scenario would be if the patient has to see another specialist or subspecialist that was necessitated because of their hospital admission.
Sure. It'd be just like back in the days when I took care of them in the hospital. If we needed a surgeon or a cardiologist to see them in consult on the floor, those physicians may also want to see them in their offices in follow-up as appropriate.
In closing, then, are there any other important points you would like to discuss about the hospitalist program?
You know, I've seen just really good, happy patients that have gotten in quickly, gotten well quickly, and gotten home quickly and timely. Very satisfying clinical outcomes. And after even the patients that are really kind of surprised that I'm not there have been through the process once, they feel very comfortable with it. I've not had anyone that have said, you know, this is unacceptable. We're going to find other health care someplace else that doesn't use hospitalists, simply because Passavant's done such an outstanding job of recruiting the right doctors to be the hospitalists and the right company to help support them.
Well, thank you very much, Dr. Hale, and we're going to close with good health to all.